I'm talking to Caroline Love, a nurse with Red Arc, the organisation which provides the Helping Hand service with Bright Grey. I'll be talking about her experiences with Helping Hand and how it can benefit IFAs and their clients. Hello, Caroline.
Hello.
So, Caroline, Red Arc is Bright Grey's partner in delivering the Helping Hand programme. Can you tell us a little bit more about the setup?
Yes, we're two offices, one based in Chester, one in Brighton, and we support people who've been referred to us through Bright Grey who've put in a claim, critical illness claim, and we advise and support them as much as possible.
How much contact do you have personally?
Well, when we get the referral through from Bright Grey, we'll try to phone them on the same day and then follow up as many conversations as the patient wants. Or we can meet them face-to-face occasionally. Again, it doesn't always happen, but sometimes we do if appropriate.
Can you talk us through the claimant's journey once Bright Grey have contacted Red Arc with a Helping Hand claim?
We would initially phone the patient and speak to them about their condition, what information they had about it, what information they felt they needed, or we would try and fill in the gaps for them. We would be able to refer them to nurse specialists or for physio if that was appropriate, or send them information as appropriate. And we would keep in touch with them for as long as they wanted.
Can you explain a bit more how Helping Hand fits with the care provisions offered by the NHS?
We like to think we dovetail with the NHS. We can explain things a bit in more detail maybe to the patients, or reiterate what they've been told by the NHS. We can provide further support when maybe physio's finished for them. We can put more in place.
And can you talk about the service you provide if a claimant is suffering from MS?
If a claimant's got MS, we would talk through their diagnosis, because there are different types of MS. We would see what information they'd be given, what medication, if any, they were started on, and be able to talk through that with them. We'd be able to put in place other services, signpost them towards things like the MS Society, where they can have more support and more specialised advice.
And what sort of service do you offer for people who have cancer?
We can, again, talk to them. That's the mainstay of the organisation, that we are, as nurses, we can talk to them. But we can also provide them with a cancer nurse specialist who can make so many telephone calls to them and support them in depth with regards to their specific cancer and their specific treatment. Otherwise, we can provide complementary therapies or advice and support and physiotherapy and things if appropriate again.
How does it differ for someone who has a heart condition or someone who's suffered from a stroke?
We can refer them to specialist nurses to discuss in depth their treatment and the way forward and any lifestyle changes they might need to have, even to the extent of a nurse maybe going and doing a home visit and being able to pinpoint things at home that might need altering or diet that might need altering. We could provide occupational therapists to go in and assess the house and make sure any disability aids were provided for them. We could signpost them towards different strokes or the British Heart Foundation or Stroke Association that would support them in more depth and in a specialised way.
Following a critical illness claim, there's obviously a risk of stress or even depression. How do you help in those cases?
Well, talking to the nurse advisor is the sort of first port of call and can be very helpful. Or we can provide them with literature or counselling if appropriate. Now,
presumably, dealing with bereavement is a very sensitive area.
Yes, it is. We can talk to people following bereavement, or to families. If a client we've been supporting has passed away, we can then support the families. We can talk to them for as long as they want, as often as they want, and provide information about helping themselves through their bereavement, because it's a natural thing. Everybody has to go through certain stages of bereavement, but we can also then provide counselling if it's appropriate.
If a patient is aware of a treatment but it isn't immediately available to them, how can you help them find out more information?
We can research where that treatment is available and signpost the patient to the relevant treatment centre, and the patient can then go back to their consultant or healthcare provider and ask to be referred to that treatment centre.
And what's the Helping Hand position on complementary therapies?
Complementary therapies can be very beneficial, especially in bereavement or stress and depression or following horrendous treatments for cancer, for example. And we can provide them with somebody locally for them, either in a local centre or in their own home if appropriate.
As far as I'm aware, it doesn't matter if people want 10 minutes of advice or support for 5 years.
That's correct. We do have people who don't necessarily want any advice, but we always give them our contact details and then they can telephone back themselves if they want it at a later date, or we have people who want to keep in touch for as long as it takes, really.
Having worked closely with people, what do you think the general expectation is when you first contact them?
People don't really know what to expect when we first contact them. But having said that, they're usually very happy and very surprised with what they find is available to support them.
In your opinion, what are the most important things that Helping Hand offers to critical illness claimants?
The personal nurse advises listening ear for as long as they want, and on the first contact the nurse gives her personal phone number and the claimant can contact at any time that they feel they need the support.
Caroline, thank you very much indeed.
Thank you.